There is no one single definition for informed consent. There are various federal, state, and local laws and regulations that specify requirements and guidelines for scenarios ranging from participation in medical research to being questioned by law enforcement. In addition to those various laws and regulations, professional organizations for each healthcare role emphasize the importance of the core concepts of informed consent for members of that profession. Whether or not we are the one to obtain formal, signed consent from a patient, we each have a role to play in ensuring that patients are given the opportunity to be fully informed about their healthcare options and be able to give meaningful consent.
Informed consent is important because it helps educate the patient, give them autonomy, and protects the provider from possible legal action. It is the provider's responsibility to communicate with the patient at their health literacy level and ensure that the patient understands enough to decide for themselves what they want to do after being informed about the process, outcome, and risks involved with the procedure. By having an informed consent, providers are given permission to perform the procedure, and hence they are protected from getting a lawsuit or being called in by the boards.
Obtaining informed consent from a patient means much more than just having them sign the necessary forms. Patients should be given options, not told what to do. They should be given time to ask questions, not rushed or pressured into signing forms they may not understand. Without a robust consent process, patients may be vulnerable to physical, psychological, and emotional harms they are not prepared for. And medical providers may be held legally, financially, or ethically responsible for those outcomes.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, "We can repair that." Great! I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, "Excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words." To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
In order to make truly informed consent possible for the patient, it is important to think of it as a process, more than just a piece of paperwork to be signed.
Okay then, Mr. Miller, we've had your blood test back, your white cells and CRP are up, so we do think it's appendicitis. What we can do for you today is take you for a keyhole operation to take your appendix out and get you better again, okay? It's a fairly low risk operation, just a few cuts in the tummy. There's some risks of pain, of bleeding and infection, and there's a risk that we might need to make that a bigger operation, okay, and cut open your tummy. I've signed here. You can just sign here for your operation today. Okay, and we'll get you up to theatres and get that done today. We'll see you in theatres.
Who is she? What's CRP? What is an appendix? What is keyhole surgery? What have I let myself in for?
What is good informed consent? Proper informed consent ensures that the patient understands the procedure, they are aware of the risks associated with it, and they are aware of any alternatives, if there are any. This information should be presented to them as objectively and thoroughly as possible. On the AMA website, they list 3 responsibilities of the provider related to informed consent. The doctor or member of the healthcare team is responsible for assessing a patient's ability to understand a procedure and its risks. This includes any cognitive, developmental, age-related, or language barriers that limit their understanding. In the previous clip, the patient gave consent to a procedure he didn't understand because he didn't understand the vocabulary of the doctor. In the second clip, a simple follow-up asking him if he understood that opened up the conversation to explore what he didn't know, and they were able to get proper informed consent. Next, the provider relays all relevant information about the procedure and the alternatives. Proper consent explains the procedure in as much or as little detail as the patient would like. Some patients may be comforted to learn more about a procedure, while others may get increased anxiety from these details. Proper consent meets the patient where they are comfortable while allowing them to decide on their own. Proper consent relays the risks of a procedure, the alternatives, and this information is presented objectively. We're in a position of power, but by educating the patient, we give them the power to make decisions about their health. Lastly, proper consent is documented in the medical record. For non-invasive procedures like a physical exam, consent is implied. For invasive procedures, written consent must be given. Timeouts have become increasingly common in the operating room before surgery. Often the informed consent form is presented there to ensure it is signed and it confirms the correct location. If consent cannot be given during an emergency, it should be obtained at the earliest possible time. Proper consent ensures that the patient has the greatest autonomy in making decisions about their care. This ensures the healthcare team is acting in an ethical way by allowing a patient to direct their care. It is our responsibility to educate a patient, no matter how busy we are. Good informed consent should leave the patient feeling better about the upcoming procedure because they understand it is the best possible course of action available for them. Finally, proper informed consent protects the healthcare team legally by ensuring that they do nothing to a patient that the patient has not agreed to. The patient understands and agrees to the risks beforehand. The signed consent form is proof of this.
Hello again, Mr. Miller. I'm Ellen Jerome. I'm one of the surgeons working for Mr. Philpott, the consultant on call today.
Hello, Doctor.
Hello. We've had the results from your blood test back.
Mm-hmm.
Some of the markers of infection are raised, which supports the diagnosis of appendicitis. And what we'd probably recommend for that is a laparoscopic appendicectomy. Do you know anything about the appendix or appendicitis?
Not a lot.
Okay, I'll tell you a bit about it now. Do you mind if I just sit here?
Please do.
Thank
Yeah.
you. All right. So imagine this is your body. Okay, there are your legs and your belly button. Okay then, Mr. Miller, so just to summarise, we've talked about appendicitis and why we recommend removing the appendix to treat it. We've talked about what your recovery is likely to be and a bit about how we do the operation. Do you have any other questions at the moment?
No, Doctor, I feel very well informed. Thank you very much.
I've written out a consent form here, so if you just happen to sign on the line. And we'll see you a bit later for the operation.
Thank you.
Informed consent is a collaborative process between all health professionals that are working with the patient. For proper informed consent to occur, all team members must know their role and scope of practice. It is also important for health professionals to know their team members' roles so that we can ensure there are no communication gaps between the team and the patient. By working together and ensuring patient understanding of the course of treatment, we can improve patient safety and increase the likelihood of high-quality outcomes.